So the first question to ask is all about breathing. And this is because if breathing goes wrong or deteriorates, it can be very dangerous for somebody. So we're going to think about the causes of breathing problems. Sometimes people have background lung problems like asthma or obstructive pulmonary disease called COPD, and this can make them more likely to develop chest infections or to get worsenings of their lung disease that cause them to become unwell. What you might see is somebody breathing faster than usual. If somebody's at rest, it's often easy to not notice that they're breathing at all. But if someone's breathing becomes faster or more laboured, where you're able to see the muscle wall moving up and down, then these can be signs that there's something causing them difficulty to breathe. Some of the commonest causes of breathing difficulties would be chest infections, and this can happen whether or not you have a background of lung problems. Other things that can cause people to breathe faster or harder are anxiety or panic attacks. And obviously knowing that somebody has a tendency to be anxious can be really helpful in helping you to know what the problem is. As well as thinking about what you might see, it's also important to think about what you might hear if someone's having a breathing difficulty. There's obvious examples like a cough. And there are many things that can cause your elderly residents to cough, including difficulties with their swallow. Even dementia itself, particularly as it gets into the end stages, can affect somebody's ability to swallow. Any neurological condition, for example, a stroke or Parkinson's disease, can also affect somebody's ability to swallow. And therefore, during eating, and you may well have residents who have a soft diet or pureed food, it means that the food cannot go down as easily, and sometimes it can enter into the lungs instead of the stomach and cause either choking problems or sometimes an infection, which we call an aspiration pneumonia. When assessing a new cough, it is useful to know if there are any particular triggers in order to help us identify the cause. For example, a cough that happens after eating might be to do with a swallowing problem or acid reflux, whereas a cough at night time can be a sign of asthma. It is also helpful to report whether it is a dry cough or a cough producing sputum, and if so, what colour it is. Dark yellow or green sputum are usually signs of infection, whereas a dry cough has many causes, including the side effect of medication. Other things that you might hear would be wheeze, which is basically the sound of air going through narrow air pipes. This can happen in infections and particularly in asthma or COPD. So if you think your resident is breathing faster than usual, or it's become more laboured, or perhaps they've developed a new cough, then these would be amber signs that mean that they require some kind of clinical review. However, anyone who's really struggling to breathe, or perhaps their lips have gone blue, or they're looking very, very breathless, this is always a red sign and would need an ambulance to be called as a 999.